Hi viewers, today let's talk about papilla preservation flap. This technique has to do in the teeth where, especially in the anterior teeth, where more spacing is there. So if wide embrasure or interdental space, we have the opportunity to preserve the flap papilla by not splitting the papilla into buccal or lingual. So before we used to do like that, we split this papilla buccal into the buccal, papilla into the buccal area, and the lingual papilla into the lingual area. This was the conventional procedure, but now here in this procedure we have to preserve the papilla. So this has to do if the spacing, if wide spacing is there, wide embrasure interdentally, and then only we can do this papilla preservation procedure. And based on papilla management, flaps are divided into papilla preservation flap and the split papilla technique. Split papilla technique is the one I told you, not we have to split the papilla here. But in this papilla preservation flap that we are going to discuss now, in that we are not going to split this interdental papilla buccally or lingually. I'll tell you how to do that procedure now. First, we have to give the sulcular incision because we preserve the maximum tissues. No submarginal internal bevel incision here, because we have to preserve the maximum tissue. We need to give the sulcular incision, but the incision should not pass through interdentally. See here, otherwise if you pass the incision interdentally, then it will split the interdental papilla. Here we are not going to split the interdental papilla, so we can give the sulcular incision here like this. We can give the sulcular incision, and buccally we have given the sulcular incision, and then palatally also we have to give the sulcular incision. See, that also we have given. See, the palatally we have given the sulcular incision, and after the, so buccally and palatally we have given the sulcular incision, and after the sulcular incision, palatal area we have to give a semi-lunar incision like this. See, like this we have to give a semi-lunar incision, should dip apically at least 5 mm, so that this papilla is easy to handle and can be pushed into the facial aspect covered with a facial or lingual flap. So here we have to give at least 5 mm distance we need to give, and then we can give the semi-lunar incision. So this is the semi-lunar incision. So by this way we have done, we finish this palatal incision, and this portion is there, no? So after the full thickness flap elevation, the facial aspect look like this. So this whole papilla has to go towards the buccal aspect. So now this is how the after the flap full thickness flap elevation, the facial aspect look like this. See, we have not, we didn't split the papilla. We have given the semi-lunar incision, and then we have taken this whole papilla buccally. Okay, so now the bone and the root surface exposed, we can give the scaling and root planing, debridement. If applicable, we can give the bone curettage, and then we need to do, see, then the flaps are placed back to its original position. So at that time, this palatal portion of the papilla is pushed back via this embrasure. So we have to push back via this embrasure onto their original surface, then we can suture this. So this is the papilla preservation flap. The main advantage of this flap is the preservation of the interdental papilla, especially in the aesthetic areas. The disadvantages are the extended flap. Here also we are giving the circular incision, so the flaps are extended, long incisions and reflection. So because of this disadvantage, we are going to do some modifications like the modified papilla preservation technique and also the simplified papilla preservation technique. So this modifications that I'll discuss in the other video. So this is all about the papilla preservation flap. That means we are preserving the papilla, especially. So now I have given demo in the posterior aspect. Mostly we are going to give in the anterior teeth where more spacing is present. So this is all about the papilla preservation flap. I think you are clear with this. Thank you.